Tonight, with COVID-19 cases on the rise, the CDC now shifting guidelines, calling on everyone to consider covering up.
The CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So this is voluntary. I don't think I'm going to be doing it.
The voluntary measure, a turn from early March, when masks were only recommended for the sick or immunocompromised.
The average American does not need to go out and buy a mask.
The new guidance stemming from recent studies showing people without symptoms play a bigger role in spreading COVID-19. New York and LA, the first to issue citywide guidelines last week.
We are afraid for our patients.
With doctors still fighting to find medical-grade N95 masks, officials are urging people to use non-surgical options. If you can't buy a mask of your own, the CDC says something as simple as a t-shirt or even a bandana can still work. A couple quick folds towards the middle adds a layer of protection. Then slip a rubber band around each end, fold again, and you're set. Even if you don't have any symptoms, wearing this can keep others safe. Nationwide, the homemade mask effort has already taken off. In North Carolina, police are putting their sewing skills to the test to make sure officers are safer when on patrol.
We should be, first of all, staying at home and practicing social distancing. And then on top of that, if you need to leave, you absolutely should wear a non-medical grade mask.
The newest step of many in the fight against an invisible enemy. Morgan Chesky, NBC News.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.